All right, well, thank you so much for sticking with NBC 23. Today, we are talking about a very important topic with stress and stroke. This month is raising awareness towards all that. So this morning, we have a medical professional with us. Go ahead and introduce yourself and kind of tell us, how is this affecting here in the Valley?
Good morning, Jeremiah. Thank you for having me. I'm Dr. Jaime Gomez, and I specialize in cardiovascular medicine. Yeah, stroke affects all populations. It does not discriminate. Certainly here in the Valley, we see quite a bit of it. One of the things that we do in our practice is we help people identify, particularly if they have an injury in the carotid artery that's giving blood flow to their brain, and we help them repair that. That's something that we've been doing over the last few years to really help people get their blood flow to their brain.
What are some things that I guess people can just keep in mind when it comes to like stroke? We're also kind of talking a little bit about stress. What are some things that people can keep in mind?
Your brain it's probably your greatest asset.
Right.
If you want quality of life, take care of your brain. So part of the awareness is to do things that are good for your brain. So see a vascular specialist, have them look at your carotids. If your brain is not working correctly, see somebody that knows something about brain health.
Got you. And so we were also kind of talking to, how is this impacting here in the Valley? Are you seeing a lot more cases come up, or have you maybe seen a decrease? How does this impact us here in the Valley?
So we're seeing more of it, more than we have ever seen before.
Really?
Yeah, it's actually concerning because it's one of these problems that as a community, as a medical, we keep throwing more money at it. But we see more of it, and it's a controversial, complicated issue as to why we're seeing more of it.
Are you seeing any particular age groups where kind of comments happenly, or is there like an older age group? What would you say about that?
I started treating stroke over 20 years ago. It was more of an older person's problem. That's not the case anymore. We're seeing younger and younger folks. The same people that would get heart attacks will get strokes. And for men, for instance, it's not uncommon to see late 40s,
right,
early 50s, which I think is very young. Women a little older, possibly 5 years older, but still very young. But we see some outliers too, people in their 30s, people in their early 40s for sure.
Wow. But what is something key that you want to just tell the community this morning?
I just want to remind people that to think of their brain as one of their greatest assets and not to take it for granted. Brain health, especially in today's environment, it won't happen by accident. You have to be somewhat intentional.
Yeah.